Hello everyone and welcome to week number 3. This week we are focusing on some pretty exciting stuff. We are focusing on vital signs, communication, and your office environment. So with that being said, we are focusing on 3 chapters this week, Chapter 5, Chapter 6, and Chapter 35. Now, for the video, I'm actually only going to be talking about Chapter 5 and Chapter 35. Chapter 6 does go over things that we talked about, in Module 2, but also things that you talked about in your lab classes in Module 2. So I'm going to leave that one for you guys to review on your own, and I'm going to focus more on Chapter 5 and 35. So let's start with Chapter 5. And that is talking about communication. Now, communication is really necessary in requirements for everyday life. There's not one day that goes by that we do not communicate with others. However, in the medical field, the ability to communicate is essential for success. Everything from calling in a prescription to be refilled to documenting a patient's complaint or their reason for visit. All of those things are communications. The concern that we have for our patients will show in our words, our actions, and our gestures. Beyond that, it will also come within our tone of voice. We have to be able to communicate with a wide variety of people in our field. Things such as patients, to physicians, vendors, coworkers, their families that accompany the patients into the visit. And there are many different channels in which we can communicate with people. For example, we have face-to-face communication, over the phone. We have letters or written words. We also have faxes and emails. All of those are examples of communication. But it doesn't just end with good communication skills. We need to have good interpersonal skills also. We need to be self-aware. We're knowing our character, values, and our attitude. We have to understand different learning styles, such as auditory, visual, and kinesthetic. So those are all things that fall under that communication and things we need to focus on. Now, when we're talking about communication, there are 2 different communication styles. We have verbal and nonverbal. Verbal is more often known as the spoken words, sounds, and tone of voices that we use. When we as medical assistants are speaking to patients, you want to speak loud enough that they can hear you, but not so loud that you're breaching confidentiality. We need to be cautious of the words that we use. So choose your words carefully and do not be rude or interrupt the patient. Do not use technical terms or medical jargon, as not all patients will understand that terminology. Take into consideration the level of education that your patient has. You have to have a positive attitude and be empathetic, not sympathetic. Then we have your nonverbal, which includes all the facial expressions, gestures, and body language, along with eye contact, grooming, and mannerisms that we use when we communicate. It's important that your nonverbal and your verbal communication match, otherwise you will send a mixed message to your patient. Now, the last thing I want to talk about with communication are the barriers that we have to go through. So when talking with a patient, we need to be aware of any barriers to that line of communication. For example, watch for defensive behavior, avoid using medical jargon, and learn the cultural differences and cultural issues, such as different languages, diverse viewpoints, stereotyping or biases, and different religions. All will have a different impact on communication. All right, so that's Chapter 5 for you. Let's talk about Chapter 35, which is dealing with vital signs. So with vital signs, what we are focusing on is this is the main responsibility of all medical assistants. And I know that some of you in my lab classes have been very excited to start learning this stuff. So vital signs really are the full responsibility of the medical assistant. What they do is they give the provider a quick snapshot of how the patient's body is functioning. And there are 6 main vital signs that medical assistants are responsible for. Those are height and weight, blood pressure, temperature, pulse, and respirations. So let's look at each of those individually to get more information about them. We're going to start with the patient's height and weight. Typically, these are done at the same time, so that is why I've grouped them together. Weight is one of the first vital signs that you will take for your patients. This should be done in a private area to make the patient feel more at ease about having this done. You always want to have the patient remove their shoes and any heavy outerwear if possible. If the patients refuse to remove items, document that in the chart so that way the provider knows that things were left on. Also, when you document a weight, you want to make sure you document it in pounds. Height, on the other hand, is taken in order to get a true height for your patients. What you want to do is have them remove their shoes and make sure that when they're standing, they've taken their feet and place them all the way back against the wall if you have a wall mount. But if you see in the picture here that they do not have a wall mount, they have it typically on this scale. So you want to make sure the patient's standing up as tall as possible. Having the patient stand with their heels, buttocks, and back of head touching the measuring wall or stick will actually allow them to stand up at their straightest, so that way we get a true height. You will then place the L-shaped bar on top of the patient's head, making sure it's on their head, not their hair. And when you're recording your height, you should always place it in inches, not feet in inches. For example, it would be 62 inches, not 5'2". Next, we have your temperature. And a normal body temperature is 98.6 degrees Fahrenheit. And generally, it is always recorded in Fahrenheit. There are 5 sites where a temperature can be taken. Those are oral, rectal, axillary or under the arm, aoral, which is in the ear, and temporal, which is across the forehead. A body temperature is usually at its lowest first thing in the morning and rises throughout the day. But there are some factors that can affect a patient's body temperature, such as time of day, age, gender, physical exercise and emotions, pregnancy, environment, infections, medication, and certain foods. Pulse and respirations are the next 2 that I want to talk about, and typically these again are recorded together. So a pulse is a number of times a heart beats per minute. A pulse is a wave of blood that comes through the body when the left ventricle contracts and then relaxes. An average pulse rate for an adult is anywhere from 60 to 80 beats per minute. And the most common site to take a pulse is the radial artery, which is located on the thumb side of the wrist. You typically take a pulse for 30 to 60 seconds. If it's regular, you can do it for 30 and multiply it by 2. But if it is irregular, you always want to take it for a full 60 seconds. Just like the temperature, there are factors that will affect your pulse rate, such as exercise, age, gender, size, physical condition or disease condition, medications, depression, anxiety, fear, or anger. Respirations, on the other hand, is the act of breathing and is the process of one inhalation and exhalation. Respiratory rates indicate how well oxygen is being provided to the tissues of your body. Respirations should be taken again at the same time as a pulse rate so the patient does not alter their normal breathing pattern. The average respiration rate for an adult is 12 to 20 breaths per minute. And again, there are factors that affect the respirations, such as age, allergic reaction, medication, disease, exercise, fever, emotions, pain, or shock. And again, you would take it for 30 to 60 seconds depending on the regularity of the breathing. Last, we have your blood pressure, and this is the most important vital sign that a medical assistant can take. It helps to aid in the diagnosis and treatment of a patient. And blood pressure consists of two readings, either a systolic, or the highest point of pressure, which is also the first beat that is heard, a diastolic pressure, which is the lowest point of pressure when the ventricles relax, and the last beat that is heard. It is typically recorded as a fraction. So, for example, 120/80 is an average blood pressure, but it's also recorded as a fraction. And there are two key pieces of equipment that are needed to help obtain a blood pressure. First is your stethoscope. The second is a sphygmomanometer, or a blood pressure cuff. Again, the average blood pressure is 120/80 for adults, and like any other vital sign, there are factors that affect your blood pressure. Emotions, age, exercise, obesity or diseases, shock, dehydration, and anxiety are just a few examples of things that can affect your blood pressure. All right, this week, that's kind of my wrap up for chapters 35 and 5. Again, make sure you're reading those on your own, making sure you're hitting all the points. I know that in your lab classes this week, you will start that discussion on vital signs, so you'll have kind of that background to kind of touch on those things before you head into maybe your quiz this week. But you do have one discussion post this week, and it is on communication. There is a link to a video that you need to watch within the discussion board, and you will then answer the questions that are in the discussion board form after you have watched that video. The initial discussion post is due Tuesday, April 18th by midnight. And again, you need to have at least one reply post to a classmate no later than Saturday, April 22nd by midnight. You have one written assignment this week on your course project for the HPV, or the Human Papilloma Virus Vaccine Information Sheet Summary. This will be due no later than Sunday, April 23rd by midnight. Please make sure that you are looking at the rubric that is posted in the Module 3 lesson plan, so that way you have an idea of what questions need to be answered and how to answer them effectively. You will also have one quiz this week on vital signs. It is 20 questions that are all multiple choice or true-false questions, and you have a 20-minute time limit. Please make sure that you have that completed no later than Sunday, April 23rd by midnight. If you have any questions or concerns, guys, please make sure that you are reaching out to me. I don't know unless you talk to me, so I want to hear from you if there is something that you're struggling with or something you have questions on. So please make sure that you're reaching out to me either via course messaging or my direct line on my campus that you can find on your course homepage. All right, guys, have a wonderful week, and I hope that you all have fun learning the different vital signs in your lab classes this week. Bye, guys.